You are listening to the Ramp on Aging podcast. I'm your host, Rob Entz with the Utah Commission on Aging, and today we are talking about advanced care planning, specifically advanced directives and pulse agreements. My guests are elder law attorney Troy Wilson and healthcare provider Dr. Cami Collette. Let's talk about the specifics of an advanced directive. Discuss with me, Troy, what powers of attorney are and how they relate to an advanced directive.
In Utah, powers of attorney and living will have both been combined into one document called an advanced directive. And most states are going that direction. So the medical power of attorney or healthcare power of attorney is a document that gives another person the authority to make medical decisions for you. The living will, which is the second part of a Utah advanced directive, is your statement of what you want in a life terminating situation, whether you want to be on life support. The living will doesn't designate somebody else necessarily to make that decision unless you want that. However, on the medical power of attorney, which is the first part of the advanced directive, you're designating a specific person, and that person is called a healthcare agent, or a healthcare proxy, or a medical proxy. There's different terms, but sometimes I'll hear people refer to my power of attorney. Power of attorney is a document. Really what they mean is my agent. That's a person. And the person is going to act on their behalf and make decisions for them.
So who needs it, and when is the best time to execute an advanced directive? Troy?
I think now, yesterday. We don't know when we're going to need somebody to step in as an agent for us and make healthcare decisions. So if you don't have one now, get one in place right away. If you do have one and it has been several years, take a look at it. Or even if it's been several months, take a look at it and make sure the agent you have in place isn't your ex-spouse. Make sure it's not somebody that you don't want. You might have had a child that matured into adulthood that now is capable and responsible enough to serve as your agent, and your document is so old that it named a friend. So have one in place now, no matter what age you are, as long as you're an adult, and for certain do it before you become incapacitated if you know when that's going to be. In other words, do it now.
So, Troy, one last question. Could you distinguish between the healthcare power of attorney and, say, someone who has a financial power of attorney?
Yes, financial power of attorney is exactly that. It deals with finances. Again, it's a document that appoints an agent to make decisions on your behalf, but those are going to be financial decisions, maybe filing your tax return or signing checks to pay bills. Does not have the authority to make medical decisions. A medical power of attorney is required to appoint an agent to make medical decisions in Utah. They're separate documents, separate language, and separate areas of the law.
So, Cami, you have famously illustrated points in time when people should consider reviewing this document. You call them the 6 Ds. Would you review those with us?
Yes. So the first is, if you haven't reviewed it in 10 years, every decade, you probably should be looking at those forms again. So it's decade. And then, of course, if your healthcare proxy has died, your spouse has died, or the person that you wanted to make decisions, their death has made it now important that you need to change and who is the next person to become important. And likewise, as Troy had mentioned, if there is a divorce, if you don't want your ex-spouse making decisions. There are some people who still lift their ex-spouse, and when I've talked with them, they still want their ex-spouse. That's fine, but just so the person that's making decisions is the one that you really want. Then there's when you get a new diagnosis, you need to kind of review what are your goals of care. And if you have a sudden decline in health, so those are the other Ds, a new diagnosis or a decline in health. You really want to relook at things and figure out who's going to be the best one to make decisions, what are the decisions you want, what types of things are you willing to live with, where are your lines in the sand. And then if you do move to a different state, That's the sixth and final day. If you have a live in a different state part-time, or have some sort of person that comes to live with you that was living in a different state, maybe you should get their advanced directives and forms updated.
So Troy, you mentioned a little bit about decisions in choosing an agent. What are some things involving the healthcare agent specifically that would cause you to want to review this?
Well, first of all, when you first choose your agent, you want to make sure that not only are they understanding your wishes, but they're agreeable to executing them. They don't have philosophical differences that would go against their principles in making choices on your behalf, for example. You also want to make sure that they have the maturity and the wherewithal to make the hard decisions.
Mm-hmm.
And then you need to revisit it periodically, because if you become incapacitated, or if they become incapacitated, it might happen that they no longer have the capacity to act on your behalf, or if they pass away, like Cami mentioned. So any number of circumstances that could cause you to revisit your healthcare document. And frankly, it's a very short document. So just pull it out every year, certainly every 10 years. But anytime you have any kind of a change, like Cami mentioned, take a look at it. And even if you don't have a change, like you mentioned, maybe at a certain holiday or something, maybe on your birthday, take it out, look at it, and just make sure everything you have is in place. The other thing that the Utah Advanced Directive allows you to do is place limitations or expansions on the agent's authority. So you want to revisit those periodically and make sure you don't want to limit those. Maybe you've had a change of heart of certain things and you want to add some limitations, or you want to remove some limitations.
Thank you.
I'd like to add one thing with this advanced directive. The beauty of the Utah Advanced Directive is you just need a simple witness. You don't need a notary. A lot of my patients, I've not ever done that because I don't know how to get a notary. And it's like, well, the advanced directive needs just a witness, your neighbor, someone who's not related. And maybe, Troy, you can say who can, there are certain people who can't witness it. I, for example, cannot be their witness as their physician. Troy, do you have anything to add on that?
Right. It can't be a family member or a healthcare provider. It has to be an independent person that doesn't stand to benefit from your demise. So it can't be even an employee of a facility, like if you're in a nursing home. So an outside person, somebody that's witnessing the signature, and you're right, notary is not required.
And it shouldn't be the two people you list on the front. They can't witness it.
Right.
And it can't be your 14-year-old daughter. They have to be
an
of age,
adult.
18-year-old.
And they have to have capacity.
And they have to be not related to you. Yes.
Correct.
So we're showing on the screen right now an illustration of what the Utah Advanced Directive form looks like. Can we talk a little bit about decisions that are being made as you drill down when you're talking about the levels of care and the circumstances of care? Can you say a little bit more about those?
Well, there's lots of things we can do. And in the advanced directive does have a lot of levels of care. I tend to like to review the pulse form because the pulse form does have some levels of care that says, I want limited, I want antibiotics, I want to have IV fluids, I'd like to have surgery if I have appendicitis. So, but then there's another level of care, and that is when it goes down to comfort care. And this is typically when we have chosen hospice and we do not want more surgeries. We don't want to go back into the hospital. We don't want to have more blood transfusions, and we don't want to have more dialysis. So those are the levels of care. We doctors can keep people alive for a very long time, since we're no longer dying of polio and measles and smallpox. We are now having cancer and having heart disease and strokes. And to live with these chronic long-term illnesses can be very hard on older individuals.
So one of the things that we have talked about is the importance of this healthcare agent. And we've talked about reviewing adequacy and our personal preferences to the authority given. So Cami, if you just lead off and talk a little bit about, if you were to pick a healthcare agent, what is it you would want that healthcare agent to be able to do for you?
Well, I want them to follow my wishes, not their wishes. So when I was choosing and making a decision, I knew I did not actually want my mother. My mother was fun, but she would love me to live forever. I would prefer my husband. He understands my wishes. I only have one son, and he actually understands my wishes. So I have a friend that had wanted me to be on. I'm her friend, but she listed her older brother, but she did not want to list her older sister or her middle brother. So this is, you really want to choose someone who's you can trust that they're going to follow your wishes and to talk with them. So I make sure I talk with the person, and I want to make sure that they know what I want, what is important to me, and that I want to get the health care that I deserve. And then when I'm ready to, my life is at the end, I want to make sure that I'm kept comfortable. And since I am an organ donor, I do want to be able to have my organs donated.
So acting in your best interest is paramount, and that's very clear. So Troy, let's talk a little bit more about that. And when you're counseling with somebody, what are some of the criteria you go through when there may be multiple options of who to choose, whether it's within a family or amongst acquaintances? What stands out as being important to you?
Well, one challenge we have is sometimes clients will come in and they'll have several children, and they want all their children to be their healthcare agent. And from a practical standpoint, the medical providers want one person and one point of contact. But in reality, what's going to happen is all of those children are going to be consulting and helping make decisions. So whoever you choose should be maybe a leader among the siblings, somebody that's respected among the siblings, in addition to the criteria that Cammie mentioned, somebody who will follow your instructions and your wishes, and who has the strength to stand up against siblings if they have a different opinion. Because sometimes you'll get into that competition between kids where maybe they believe different things about what their parent wanted. That's also why it's important to have it in writing and something that they can refer to demonstrate what the parent wanted. So if you have an estranged child, probably not the best candidate, but if you have a child that gets along with the other children, because they're all likely to be involved with the decision, I think that's an important consideration, at least to discuss with the client.
Now, the Utah document allows for the designation of an agent and I believe an alternate agent. Is there a limit to how many agents you can have?
There's not, and we discuss whether they want them to be acting together or if they want them in sequence. And what we encourage, again, is a single agent to act and then an alternate in case that agent can't, because we can't predict who may not have the capacity or who may predecease the client. And so it's always good to have 2 or 3 deep as alternates if you have those choices.
So let's just answer the question, what triggers the agent's role? First from a medical perspective and then a legal perspective. Cammie?
So usually it's an emergency setting. They have either had an accident or become deathly ill, and they're in the hospital and they need a surgery or they need something to be done. And we physicians need to speak with the family and have permission to do the emergency surgery. And we as physicians feel that it will save their lives, and they are still alive. So their heart hasn't stopped and they're still breathing. So when they need a surgery, we need one person to be able to sign for that surgery. So that's why it's nice to have one person designated as the person who's going to be signing the document. Mom may have dementia by now. She can no longer make decisions, but she's fallen and broken her hip, and she needs to have that hip repaired. We need to explain the risks and benefits of the procedure and have one person sign permission, and that is the healthcare proxy.
Troy?
I think everything Cammie said, I would reinforce that. And again, one person is going to be the easiest. It's important to know too, it doesn't always have to be a life-threatening situation. Cammie brought up the case of dementia. A lot of clients think that the healthcare agent is really more of a, what if I'm in a terminal condition document. That's not the case. They may be in a ski accident or an auto accident and be so drugged up on pain meds that they can't analyze the information that medical providers are giving them and make an informed consent decision. So there again, even though they're not terminal, they need somebody else to act on their behalf.
Thank you, Troy and Cami. This completes the second segment of our discussion on advanced care planning documents, specifically our conversation about advanced directives in Utah.